healthy aging would be.
Basically being independent.
Lot of difference in the coming years.
Is it okay for them to eat so much of protein?
That gets deposited in the body. Dementia.
So can dementia be treated?
Yes, dementia in early stages can be treated. There are again this cognitive stimulation that can be done. Then there are certain drugs that you can give them. In early stages, it can be treated, and there are things that you can do to slow the progression of the disease. But
It's inevitable, isn't it?
yeah, full-blown dementia is inevitable. So that is what there have been researches that they have found out that insulin resistance also affects the nerves.
Oh.
Okay, so if you are correcting your insulin resistance, you might cut down your risk of dementia in the future. So these are very early stage researches that are there.
Interesting.
Yeah, so there are things that we can do now, and there is something called as pseudo dementia, right? Pseudo dementia, you have like depression, vitamin B12 deficiency.
Oh my
Thyroid.
God, really?
Yeah, thyroid illness. So we have to correct all of this in these people. And then if it is not getting corrected beyond that, then we'll have to.
You had told vitamin B12 deficiency and thyroid fluctuations also may be a cause for dementia, right?
No, pseudo dementia is something that you have to rule out these things in them before labeling them as
Okay.
Alzheimer's or something.
So then what is Alzheimer's?
These are reversible dementias, what we call reversible dementias.
Okay.
We have causes for that.
So what is the difference between Alzheimer's and dementia then?
It's the same thing. Alzheimer's disease causes dementia.
Okay.
The Alzheimer's is the commonest form of dementia, you can say.
Oh, okay, got it. So when I'm in 40s or 50s, right, can I get myself tested for dementia in the future?
Yeah.
If I might get over.
Yeah. So there is something called as mini mental state examination, which is done in a OPD setup. There is a certain number of score that it gives, right? So you can track your score. If it is falling beyond the normal limit, then there is something that you might be at risk in the future. So we can screen yourself for that.
Okay.
And then there is a simple clock drawing test and all. I think you can just Google and then you will know. There is clock drawing test, which becomes impaired in people who have dementia. So they'll not be able to draw that normal clock with the proper spacing in between letters and all. So these are the things which are done as a screening. So with these we can find out.
Oh.
We don't have to wait till it becomes very late. That is what it means.
Okay. So old people, right? Forgetfulness is something very, very, very common. So when is it that any individual is supposed to seek medical attention? When what is the bar? Is it basic forgetfulness is okay, or is there any red flag that anyone should look out for?
Okay. Basic forgetfulness is when you're not able to remember a name or where you have kept a particular thing, and then you remember it after some time, right? They're usually able to remember it after some time, but they're getting lost at familiar places. Okay, they're not able to find their way back home, or they have problem in executive functioning. Executive functioning in the term, they're not able to manage their finances, which they're able to do previously. They're not able to go shopping. Shopping requires a detailed list of things that you have to do, right? They're not able to carry that out. So executive functioning is abnormal. Then there is slowly memory decline is happening. What they were able to do a couple of months back, you see that they're not able to do it now. So this progressive loss. Then there is a psychological and behavioral issues that they might be having. They are more irritable. They are always angry. They are always sad. So all these things you have to, be a little alert that something might not be as okay as it looks. Okay. So these are the signs that they have to look for. Second thing is they have to differentiate it from something called delirium. Delirium is a acute confusional state, right? So this happens in old people, but it is not a pervasive thing that is there, right? So the baseline, they might be okay, completely okay the previous day. They might be able to remember everything, but suddenly one day they're not able to recognize you, or they have some issues that you see are very acute when compared to the previous day. What happens in older people is infections don't show up as they do in younger people. They might not have fever, they might not have what we call localizing symptoms. They might not have cough, even if they have pneumonia. Okay, they might not have urinary symptoms even if there is a UTI. So, in such people who have this acute onset, we have to look for underlying causes like pneumonia, urinary infection, a heart attack also sometimes, sodium disturbances. All of these cause them to have a acute confusional state. They are not able to make out whether it is day or night. All those things in a apparently normal person. Okay, so that becomes delirium. You treat the underlying cause, the delirium goes away. In some people whose relatives are not staying with that person, you do not know what that baseline thing is. You evaluate them for any bodily disturbance. You treat it if you find anything. In spite of that, they are not able to, be normal, have a normal conversation, recognize what time it is, and all those things. Then you label it as dementia.
Oh, okay. That's very interesting. So, old people will not get fever, cough like
Most
how
of them, they don't.
they have
Like, even if they have a frank pneumonia, they will not get those high fever and all.
Okay.
Because the immune system ages, right? It is not very, what is it, exuberant in mounting a response against the intruder. So that is where, we have to be careful.
That's very interesting. So, when there is an old couple who come, right? If you see majority of them, their kids are abroad, they are not here and all that. So they come up with some issue, telling that my joint is paining or I'm feeling giddy and all that. But the underlying cause might be depression, right?
Right.
So how do you actually tell them that you are under a depressed state? You have to take some counseling, right? It's a very challenging thing. So how do you identify that and how do you communicate that to that person?
There are certain scales that we see, whether they are finding their previous pleasurable activities still pleasurable. Okay. So that is one thing. And we check whether they have, hope for future events, whether they generally feel happy. So these are certain screening things which we do. But I think there is this big taboo that has been there from their times, that it becomes difficult for them to accept that they are depressed. So that is something that we need to have more awareness regarding that, and then that needs to be addressed. But otherwise, it is not taken well if you tell somebody that you're depressed.
Yeah, because they feel that it's a mental illness. Are you calling me a mental person? Mentally affected person is what they immediately think of, right? So counseling is very important, right? When
that barrier is still there. Like, it is a predominant thing. Even if the kids are very much well educated and aware of all these things, it becomes a little difficult for them to take, because it has been taught to us in the right from our childhood that people who have good mental strength will not get depression, rather than thinking it off as a disease. Like, there are certain things that the brain is not able to produce, certain chemicals that the brain is not able to produce, because of which there is depression. Rather than thinking it of that way, we attribute it to our own mental strength, that we are not able to handle this. So when the narrative goes that way, it becomes very difficult.
It's like boys shouldn't cry.
Yeah, something like that.
Something like that. So these days, if you see 30s plus, right, they take multivitamins, they take calcium, iron, zinc, name it, they take, you have supplements coming in all forms available everywhere. Even in Amazon, you get all of that, right? Which is good. No harm. I mean, of course, if you have a deficiency and if you have to be prescribed by a doctor, it's a different story. But after an age, I still see, there used to be a neighbor of mine, very old couple, right? Some 80, 85 plus, both of them. They will have multivitamins. They had multivitamins till they died that day. Both of them died probably one day here and there. And they used to have multivitamins till that day. So, is it true that after an age, the multivitamins, your body will not be able to accept the, the medicine that you're eating, the multivitamins that you're eating? Is it true, or does it really stay good?
See, it's not that your body is not able to take multivitamins. Basically, what we have to remember is vitamin A, D, E, and K. These are fat soluble vitamins. So you have to take them in the prescribed dose only. Whatever excess you take, that gets deposited in the body and causes toxicity. Okay, these medicines. B complex medicines, on the other hand, are water soluble. That is, they will be excreted in your urine. So, to an extent, you can continue to take B complex every day. But then again, it has to be tailored to each and every person. But there is nothing like they will not be able to tolerate or they will not be able to digest. ADEK, you have to be very careful because excess dose causes toxicity.
So what is it with this B12? Because again, B12 is becoming one talk of the town now, right? You have gummies available online, you have multiple things available online. Is it safe and good to have B12 just like that? Because CBC, you will get your B12 report. And CBC is something everybody does it 6 months once or something like that, right? So that much of awareness has come. So is it okay for somebody to just go take any biotin gummies or B12 gummies or anything like
Not really, not over the counter. If you're a vegetarian, you're usually deficient in B12.
Yeah.
So you have to get yourself tested, and if you're low, then you'll have to take the supplements accordingly. This is what I say. But I don't recommend taking over the counter.
So you see so many old patients day in and day out. What is the one common thing that you have seen that, oh, I should have done this, I really regret not doing this?
I think unanimously it is that they should have taken better care of themselves, rather than focusing their time and energy on other people exclusively. They should have spent a little more time on self-care, wherein they could have still retained their independence.
So watch out, self-care is very important, 30 plus. Okay. So sleep again is a big issue, right? Challenging issue is what I will say. Is it mandatory that old people like 60 plus need 8 hours of sleep? Because majority of them, if you see, I slept at 1 o'clock, I woke up at 3, they have a very disturbed sleep cycle. How important is it?
There is this very obvious change in the sleep cycles as we age. Okay, so what happens then, that most old people have the habit of having a afternoon nap. So once they have that afternoon nap, which if goes beyond 1 hour or so, then they will have difficulty with sleep initiation in the night. Again, they will have other problems like tingling in the legs, or they will have frequent urination, because of which they are not able to do the, have a proper sleep. So I wouldn't recommend 8 hours as such, because the requirement is only little lesser than that. But they have to take care of these other problems that I told about, whether they're having this tingling in the legs, or they're having urinary difficulties. They should address them. Try to cut down on your afternoon sleep. Have a fixed routine for your, going to the bed. The time has to be a little fixed, and they should avoid this blue light exposure, which nowadays, it's getting into our old age persons as well, that they continue to scroll on their mobile. So that exposure has to come down 1 hour before sleep, and they have to cut down on caffeine and all. So restful sleep, even to 6 to 7 hours is okay. So it is not that we have to go for 8 hours.
Okay. To wrap it up, right? What is one thing that you will say if I come and say I have an aging parent? What is the one advice that you actually want to give me to take care of them well?
Right. So I would tell you that you have to start looking at your parents from their health from a preventive perspective, rather than going for the curative aspect, which is there nowadays, that you react when there is a problem. That should not be the case, because once something destabilizes, then it becomes a domino effect from then onwards. So rather than that, you have to screen your parents for certain things. If they have risk of fall, you have to address that by strengthening their bones, muscles, getting their sensory levels checked in terms of eyes or ears, all those things. If they are having some difficulty in chewing or swallowing food, if there is some dental issues, you address it before it becomes a problem. Not till they don't have appetite. You don't let it go till there. So prevention first has to be your approach to your parents. Okay, so you have to get this preventive vaccination done. The whole perspective of how we are looking after our aging parents has to be changed, and it has to start with us. So that when we age and become old, we have a better blueprint for that.
Old age begins at?
Age again, age is in your mind.
Okay. Memory or mobility? What do seniors fear losing more?
Mobility.
Walking stick or walking buddy?
Walking buddy.
One food you'd tell every senior to avoid?
Avoid your deep fried stuff because we can't digest that.
Most underrated habit for healthy aging?
Hmm. Exercise.
Early dinner or intermittent fasting?
Early
What
dinner.
wins?
Early dinner.
Biggest myth about aging that you would want to bust?
That it is inevitable.
What is harder, treating the patient or convincing the family?
Both.
Retirement, blessing or boredom?
It's a blessing if you plan well.
If aging was a movie, what would the title be?
Maybe it will be something like a beautiful fade.
That's amazing. Okay. Thank you so much. So, all the beautiful young people out there, it's a very, very informative session that our Dr. Nishmitha has given us. Please watch out and go make a difference and make a difference in your lives too. Thank you.
Thank you.